Hey, Dr. Aaron Moreland here from Vallejo Health and Wellness Center in Eden Prairie. And the reason I'm making this video today is because of a patient that just came in recently. A patient really reminded me of my dad's story. My dad had phoned me a few years ago dealing with some back pain. And so he wanted to see what my opinion was on it. And so he was dealing with pretty significant back pain, although at the time when I talked to him, it didn't sound like it was as significant until I saw him a few weeks after that phone call, and he was using a cane. So he was in pretty significant pain. And so he had started seeing different doctors for it, and he went to a doctor that did some x-rays and then ordered an MRI finally because they weren't exactly sure what he was dealing with. He sent me the MRI report, and I took a look at it, and it listed actually quite a few things wrong with his back. It did say that he had a herniated disc. A herniated disc, on this model here, a disc is this clear thing, and that disc can actually herniate out the back and then put pressure on that nerve right there. And so they said that he had a herniated disc. They also said he had degenerative disc disease. They said he had arthritis in his spine, specifically in this joint right here, which we call the facet joint. They said that he had arthritis in there. They also said that he had stenosis. Stenosis is this little hole right here, so foraminal stenosis. This little hole where that nerve comes out was getting smaller because he was developing some bone spurs from that arthritis. So there was a list of things that he was dealing with on that MRI report, and the doctor said that the best thing we're going to need to do is we're going to need to do surgery on your back. And so when I talked to my dad, I said, well, what exactly is the surgery going to be? Are they going to do something with that disc? Are they going to clean up the hole for that stenosis? Are they planning to fuse your back? Well, he didn't know the answer to that. He said that all I know is that they have to have surgery, but he did say that it was going to take 18 months before he got in to go see the doctor. And so he had a lot of time to figure out maybe there's something else that he could do for this rather than having surgery. So like I said, he showed up a few weeks later. He's using a cane. So again, pretty surprised at the amount of pain that he was in. So my dad's a very active person. And for me to see him using a cane really did tell me that there's something significant going on here. And so I took a look at him, and I found that really one of the things that he was dealing with was he had a lot of trigger points in those muscles. And he had been doing some physical therapy already, but the physical therapy wasn't really doing much for him. But he was doing them very consistently, 3 times a day actually. He was doing these exercises. Wasn't really seeing a big change. But I noticed that he had some trigger points in the muscles. I also noticed that he had a few joints that were very locked up. One of them being his SI joint, which is this ilium, sacrum, sacroiliac joint, SI joint. Okay, that was locked up. His L5 was locked up. So I could see that chiropractic care, along with some good muscle work, would really be beneficial to him. So I worked on him. I worked on him 3 times when he was at my place. And by the time he was ready to go home, he didn't even need to use his cane anymore. He was feeling so much better. So one of the things that I told him to do is when he gets back home, go find a good chiro, one that will do some muscle work and get those joints moving. Continue to do the physical therapy. I feel like the physical therapy wasn't working because they kind of put the cart before the horse, meaning he had these trigger points, and then when he would do these exercises, they would activate the trigger points and actually kind of making things not necessarily worse, but causing the pain to be worse. And so he went back, I think it was a few weeks, maybe a few months, that he worked with another chiro and physical therapy, kept doing the physical therapy exercises, and then completely better. Never needed to have that surgery. He's feeling better. I just saw him a few weeks ago. He's doing well. We went on a nice big hike. So he's super active. Never needed that surgery. And the reason why is because they looked on that MRI and they saw all these problems wrong with his spine and just made the assumption, well, that's where your pain is coming from. And I just saw a patient just the other day that came into the office, same thing. I looked at his MRI report. They had listed a bunch of things, and they gave him just a few options. He's doing physical therapy right now, not really doing better. They gave him an epidural injection, didn't make much of a change. So now they're saying, really, probably the best case is that we're going to have to fuse your back to get rid of this problem. Again, I looked at all these things, and I'm like, okay, you have all these things, but is that really where the pain is coming from? I did a history, and it was interesting, the things that, based off of what that MRI showed, the things that he was doing that did not cause pain was kind of surprising, because I would have assumed that if he was doing these certain things, it would have caused pain just based off the MRI report, but they didn't. And so then I started looking at, through the exam, looking at the muscles and the joints, and found that there was joints that were locked up, found that there was muscles that had lots of trigger points in it. So I started pushing around and recreated a lot of the same pain that he's dealing with. And that helped me to know that, hey, I think your problem is not coming from your spine per se, as much as it's coming from those joints that aren't moving well, that are locked up, and coming from the trigger points. And so I worked on those, and right away he could feel better. Now, as he does these physical therapy exercises, that should help releasing the joints, getting the muscles to feel better, and continue to work on that. And really, it should just take a few sessions, and we'll know if we're on the right track. And so again, just because something shows that there's a problem, like I said, on the MRI, if you looked at it, it definitely looks like there's lots of things wrong with his spine, but that doesn't mean that that's where his problems come from. Just similar, I don't know if you've ever heard this analogy, if you were from another planet and you came across a vulture eating an elephant, you'd make the assumption, well, that vulture killed that elephant. And we, living in this world, know that vultures don't kill elephants. They're just there to clean up the dead tissue. And so just because you have an MRI that shows you have all these problems doesn't mean that that's where your pain is coming from. Of course, those things need to be addressed, but that being said, helping him get out of that pain will allow him to get back into exercising, because he's actually been told, don't exercise anymore, don't do anything until we figure this out, till we get rid of your pain. And really the best thing he could be doing right now is exercising. It's just that we needed to get rid of the things that were causing it to have pain. So hopefully this is helpful, because I think that there's a lot of people who go to doctors, and a lot of doctors, unfortunately, they just use your imaging, they use your labs to make a diagnosis and then make a plan of attack, rather than looking at you as a patient and trying to figure out what's going on with you. They're diagnosing off of lab tests and images, and the problem is that's not good doctoring, and we see it time and time again. So hopefully this video is helpful. I'm going to keep making videos like this so that, one, you can get to the right practitioners you should be going to and knowing how to make that determination. And then two, is there things that you could just be doing on your own that you don't need to be going in to seeing a doctor, a chiropractor, a physical therapist? Is there the things that you can do that could save you a ton of money because you could figure it out on your own? And then if you can't figure it out on your own, you do these things and it's still, the problem's still there, then you go in and you can see the doctor like myself, and we can help you. So again, my name is Dr. Aaron Moreland with Vallejo Health and Wellness Center. And again, just watch for the next video, and hopefully this has been a helpful video for you. God bless.